Dear students, welcome back. In the previous session, we have discussed about the gluteus maximus muscle. Now, in this session, we are going to discuss about the remaining muscles of the gluteal region. Okay. So, we have seen that the muscles which are arranged below the gluteus muscles, gluteus maximus muscle, from above downwards. So the first muscle is the gluteus medius, and then gluteus minimus, and then we find piriformis. Afterwards we can find the gemelli. In between this gemelli will have the what you called as the tendon of obturator externus, and after inferior gemelli we can see the quadratus femoris muscle, and finally obturator externus are also related to this gluteal region. Okay, now we will see the first muscle that is below the gluteus maximus is the gluteus medius. So it is originating from the gluteal surface of the ilium between the anterior and posterior gluteal lines. In between anterior and posterior gluteal line. So this one is the anterior and this one is the posterior gluteal lines. Okay, and it is getting inserted. This muscle is getting inserted on the lateral side of the greater trochanter of the femur. On the lateral side of the greater trochanter of the femur. And this muscle is supplied by the superior gluteal nerve. Superior gluteal nerve. And the main action of this muscle is, so this muscle is present on the lateral aspect. So because of its presence or the course of this muscle, we can say this muscle helps in the abduction as well as the medial rotation of thigh. Medial rotation of thigh. So one is abduction, another one is medial rotation of the thigh. This is the origin, insertion, nerve supply and action of gluteus medius. And next we'll move on to the gluteus minimus muscle. Yes, the gluteus minimus muscle is originating from the gluteal surface of the ilium between the anterior and inferior gluteal lines. So this is the anterior gluteal line and this one is the inferior gluteal line and this is posterior gluteal line. So in between the anterior gluteal line and the inferior gluteal line, the gluteus minimus muscle is originating, and this one is getting inserted on the lateral part of the anterior surface of the greater trochanter. Lateral part of the anterior surface of the greater trochanter of the femur, and this one is also supplied by the superior gluteal nerve, and the action is also similar to that of gluteus medius. Because of its location, we can say this helps in abduction and medial rotation of the thigh. So now we are seeing this bone on the lateral aspect. Okay, this hip bone and the femur. So this is about the action of gluteus minimus. Now we will see the origin and insertion of the piriformis muscle. Yes, piriformis. So here one interesting thing before this piriformis. So I want to again want to explain the ligaments, that is sacrospinous ligament and sacrotuberous ligament. So as we know that this sacrotuberous ligament and the spinous ligament, which are the structures, these are the ligaments which are present below this gluteus maximus muscle, isn't it? So the name itself, the sacrotuberous ligament, which is originating from the lateral aspect of the sacrum as well as the coccyx, and which is getting inserted at the ischial tuberosity. So it is called as sacrotuberous ligament, isn't it? And another ligament called as sacrospinous ligament, which is also getting attached from the lateral surfaces of the sacrum, and it is getting attached to the spine. So ischial spine. So because of its attachment of this spine, we are getting, because of these two attachments, we are getting two spaces that is called as foramens are formed. One is the greater sciatic foramen, another one is the lesser sciatic foramen is formed. Okay. So because of this sacrospinous ligament, we will get this greater sciatic foramen, and which crosses this sacrotuberous ligament, which crosses the sacrospinous ligament, forms the lesser sciatic foramen. So why I am telling this means the structures of the pelvis will comes out of the pelvis through these notches only. Here, if you see the piriformis muscle, this muscle is also come through this greater sciatic notch, and which come outside to the gluteal region. So now how it is happening, now we will see. The piriformis muscle is originating from the anterior surface, okay, anterior surface of the sacrum by three digitations, okay, and this muscle on the anterior aspect, which is come to the gluteal region. So through the what notch? Greater sciatic notch. So here you can find very clearly from the anterior aspect the muscle is getting originating, and which is coming out through the greater sciatic notch, and which is getting inserted into the upper border of the greater trochanter of the femur. Okay, this muscle mainly helps in the lateral rotation. Okay, so this muscle is mainly helps in the lateral rotation of the femur. So this is lateral rotation of the femur. Okay, and it is also acts as an abductor. So it acts as an abductor of flexed thigh. It acts as an abductor of flexed thigh. So the nerve supply is getting direct branches from L5, S1 and S2. Okay, so these are the nerve supply of this piriformis. Now we will move on to the other muscles. Okay, that is Gemelli. Okay, yes. So here we will see the gemellus. So it is having two gemellus. One is the superior gemellus and inferior gemellus. Superior gemellus is originating from the dorsal surface of the ischial spine, blending with the upper part of the tendon of the obturator internus. So in between these two gemelli we will have the tendon of obturator internus, isn't it? Yes. So that is the origin of superior gemelli, and which is getting inserted into the medial side of the anterior part of the greater trochanter, which is also blending with the tendon of obturator internus. So this muscle is supplied by the nerve to obturator internus. Okay, which helps, this muscle helps in the lateral rotation of the thigh. So the inferior gemelli, so it is originating from the upper part of the ischial tuberosity, below the groove of the obturator internus tendon, internus tendon, which is also getting inserted same as that of the superior gemelli, that is medial side of the greater trochanter of the femur, blending with the tendon of obturator internus. So now this muscle is also supplied by a nerve to quadratus femoris. Inferior gemelli is supplied by nerve to quadratus femoris, which also helps in the lateral rotation of the thigh. So this one is also helps in the lateral rotation of the thigh. Okay, so if you see the origin of this obturator internus, so this obturator internus muscle from the pelvic surface of the hip bone include body, superior ramus and inferior ramus of pubis, ramus of body of ischium, part of ilium, and also obturator membrane. So these all these are the origins. So from the inner side, okay, from the inner side, that is the pelvic surface, this muscle is getting originating. So here the tendon leaves the pelvis through the lesser sciatic foramen. So I have already mentioned before how this foramens are formed. So this obturator internus tendon is leaving the pelvis and coming to the gluteal region through the lesser sciatic foramen, and it is also getting inserted. That means here before insertion, the tendon then runs laterally behind the hip joint to reach the medial surface of the greater trochanter of femur. Okay, so it also helps in the lateral rotation, and this one is supplied by the nerve to obturator internus. Okay. Next, we will move on to the other muscle, that is obturator externus. So this obturator externus is originating from the outer surface of the margins of the obturator foramen and medial 2/3 of the outer surface of the obturator membrane. Okay, and this one is getting inserted into the trochanteric fossa of the femur. So this one is inserted into the trochanteric fossa of the femur. If you see the nerve supply, it is supplied by the posterior division of the obturator nerve. So it is supplied by the posterior division of obturator nerve. This one is also helps in the lateral rotation of the thigh. So these are all about the muscles of the gluteal region. Okay, so if you see the applied anatomy, so normally the site of choice for the deep intramuscular injections is the upper and the outer quadrant of the gluteal region. So as we know that this is the gluteal region, and which one is divided into 4. So this upper and outer part, upper and outer quadrant of the gluteal region is used for intramuscular injection, because at that region where there are the gluteus maximus, medius and minimus muscles are present, and no risk of injury to any nerve or blood vessels are going to take place. And gluteus medius and minimus of both sides contract alternately, first on one side then on the other side during normal walking. So these are some of the applied anatomy related to these muscles. In the next session we will see back of the thigh. Thank you.